Hi, everyone. This is Dr. Brandon Nutt from the Wellness Institute of Dallas. Just wanted to do a quick presentation on our concierge practice and what really makes us different and what we believe healthcare, the direction healthcare needs to be going. We want to share with you our mission, and share with you the way that we believe we are going to be able to revolutionize and change the way that healthcare is done. First of all, this is our tagline here, kind of our slogan, our office slogan is health you can feel, care you deserve. And you're going to understand, we'll talk about this later, but you'll understand why we say that here at the Wellness Institute of Dallas. So first off, let's talk about our vision. So we want to redefine the standard of healthcare in our community to change the current trends in health and the way that healthcare is done. We're going to talk about all the different things that we think are being done properly and all the things that are missing from our healthcare. Our mission is to reconnect the community to what true health and wellness is through functional and integrative treatment, education, very importantly, education, and connecting patients and people to synergistic community resources. What do we mean by that? That means making sure that people know their local farmers markets, making sure people know how to get healthy foods, healthy meats, things that are not as processed, things that are going to be a little bit more on the health and wellness side of things, and not relying on packaged foods and processed foods and things that have a shelf life of 25 years. So chronic disease in America is really plaguing our healthcare system. And if you look, 6 in 10 adults in the US have a chronic disease, and 4 in 10, nearly 50%, have 2 different types of chronic diseases or more. So this includes diabetes, Alzheimer's, chronic lung disease, your cancers, your heart disease, your stroke, your chronic kidney disease, all these different and thyroid disorders, hormone disorders, brain fog, memory issues, mild cognitive impairment, you name it. Most people in these 6 in 10 are suffering from these chronic illnesses, but are not getting any real answers. Medication is one route that people can use, but and this is why we think we're going to redefine the way that healthcare is done, is because, we don't solely rely. The only tool in our toolbox is not medications. We like to talk to people about nutrition and supplementation and different types of diagnostic testing that we can utilize to figure out what is the true cause of your disorders, your long-term diseases, your chronic diseases, and give actual solutions. Chronic disease is the largest contributor to the $3.8 trillion in annual healthcare costs. $3.8 trillion. I read a report showing that Alzheimer's disease by itself, Alzheimer's disease, also known as type 3 diabetes in the research. A lot of people don't know that, but diabetes more than doubles your risk of Alzheimer's disease later in life. So it's supposed to bankrupt us by 2050. Supposedly, we're not going to have enough money to help take care of these people that have memory issues by the time it's 2050. And there's a lot of things that are leading into that, and a lot of reasons why people are having these types of disorders. But looking for a magic bullet, a magic pill to fix all these problems is really not the way to go. And that's why we have an integrative office here at the Wellness Institute Dallas. We have people who can prescribe prescriptions, people who can use nutrition and supplementation as their tools in their toolbox. So think of it as like if you have someone working on your house, you don't only employ electricians, because if you have a plumbing problem, you don't want necessarily an electrician trying to deal with that. You want a master plumber. You want a master electrician. You want someone who's a master at helping with masonry, or people who can work on foundations, or people who are designers, people who can do things that are different than other people. So relying on one source or one type of provider is really limiting our ability to help people with these chronic diseases. That's a really important question here, and asked at the bottom: is our current healthcare model working? If we rely on people who went to school to learn about medicine, again, it kind of comes down to, are we relying on medicine to make us healthy? And at the end of the day, we know people that are on 15, 20, 40 medications after the average 65-year-old takes 27 prescriptions a year, 27 different kinds of prescriptions a year. if I were to put two people and ask you which one you want to be, do you want to be the person who takes 27 prescriptions for a year, or the person who takes zero and has, I think that we would all prefer to be the person who takes zero. Now, what is that person who takes zero doing to help maintain that zero, what we call zero prescription healthcare? If you take prescriptions, what is your plan to get off of those prescriptions, or help your physiology maintain homeostasis, or get to a place where you don't have to take those prescriptions? And at the same point, how are people who are taking zero prescriptions, how can we maintain that zero prescription healthcare plan? Right. And that's what our office does here, integrating the best of medical and the best of natural holistic care. So the solution: traditional healthcare is fantastic. If I get in a car accident, I don't want to be anywhere else in the world besides America, because we are really great at saving lives, but we fall flat on the chronic illnesses. And that's because if we're providing life-saving solutions for chronic disorders, life-saving solutions as in, if I have a car accident, I need a tracheotomy or something like that, or if I need brain surgery, if I need some kind of surgical intervention, that's fantastic. We're the best in the world at that. Okay, but when it comes to chronic disease, we really fall flat because we're relying on the same solutions. So when it comes to traditional healthcare, we offer this very, very similar to your primary care physician. We want to be able to oversee your healthcare, basically act as a primary care physician. Our team will act as your primary care physician, with an added focus on root causes of symptoms. We're not just going to say you have acid reflux, here's your proton pump inhibitor, because we know the long-term problem with taking PPIs can lead to B vitamin deficiencies and lead to peripheral neuropathies and things like that. Every medication doesn't have a single purpose. It has side effects, things that are not intended. And at the end of the day, these root causes are really not necessarily ultimately fixed, but they're managed. Okay, and we don't want our chronic diseases managed. We want to fix them long term. And the way we do that is these three additional aspects of healthcare that we believe are missing. The holistic side of things, focusing on why chronic health complaints have been present and forming a plan to address the cause. A lot of times, lifestyle plays a big role in why we're developing these chronic diseases in the first place. Education. Right? So if you don't know that hitting your thumb with a hammer is causing your thumb to be sore, then we probably need to talk about that hammer hitting your thumb, right? And it seems really blatantly obvious, but a lot of people don't realize that the things that we're exposing our bodies to, the things, where we live, our environment, the foods we eat on a daily basis, the air we breathe, the chemicals that we put on ourselves every single day. Women, I'm talking to you, you're typically putting 4 to 10 times more chemicals on your body than men are. So we like to focus on education. Let's talk about different things that can be a healthier solution. That's kind of going back to reconnecting you with things that are going to really help with your chronic disorders and help prevent chronic disorders by talking about local resources, meats that are not processed using bad processing practices, things where, no antibiotics, essentially organic, and knowing where those animals are coming from. Same thing with your vegetables. What's being sprayed on your vegetables? What's being sprayed on your fruits? And educating people on, things that we should be looking at in the grocery store, and things that we should be looking at on ingredients labels and those types of things. So health coaching, mentorship, those are the things that we need. If you want to get better at tennis, you hire a coach. If you want your health to be better, you hire a coach. And innovation, right? So I think a lot of times people realize that, the treatment for a lot of these chronic illnesses hasn't changed in a really long time. Chronic illness is one of those things that if we keep doing the same thing over and over, I think that's the definition of insanity. So I think we can really find ourselves improving our health and improving our health care if we allow innovation to happen. And unfortunately, a lot of times treatments and therapies are restricted based on what insurance will pay. I had a patient the other day tell me that her doctor didn't run a full thyroid panel because insurance wasn't going to cover it. The full thyroid panel only costs $92. She's more than happy to spend that, but her doctor didn't even give her the option because he told her that insurance wasn't going to cover it. Well, what if I told you that that full panel consisting of 11 thyroid specific markers instead of the 2 that were ran will give us the answers that we need to start doing some things to help her thyroid problems in the long term, as opposed to just continuously putting a Band-Aid over top of the symptoms using a medication. And in her case, it wasn't working very well to begin with anyway. She was still having a lot of the same symptoms. So a lot of times we just have to dig a little bit deeper, but insurance and standard of care practices are withholding us from actually developing these new innovative techniques. So when it comes down to concierge care, concierge healthcare, everyone needs to realize that, sitting down and having a 5-minute visit once a year or once every 6 months, that person, that doctor, that provider, that nurse practitioner, that physician's assistant, that primary care physician, there's no way they're going to learn enough about you in that 5 minutes and that 3 sheets of intake paperwork to really understand the complexity of your health. Health is very, very complex and has many, many different factors that need to be taken into consideration, not just what your family history is and what medications you're taking and things like that. We need to sit down and have quality time. So here at the Wellness Institute of Dallas, our initial visits are 90 minutes long. So you can give us a full briefing of your health, and we'll kind of guide you along, asking about certain things, certain supplements, nutrition, all those types of fun things, and really get to know you and really have you become part of our family. Direct communication with your team of providers. I think it's unbelievably important. If you go 6 months between talking to your provider and you show up and say, hey, this hasn't been working for the last 6 months, I think you need to have something that is in place to give you direct attention. If you start doing something that's either very positive for your healthcare or very negative for your healthcare, or maybe not negative or positive, and you just think we need to know about it, then we absolutely need to know about it. Direct communication with your team of providers is crucial here. Attention to detail. Again, having the time allows us to have that attention to detail. Patient-specific mentorship to meet your goals. Does your doctor know your healthcare goals? Have you gone through, these are my top 3 things that I worry about in the future. I have a family history of cardiovascular disease, or I have a family history of cancers, or family history of stroke or Alzheimer's or something like that. We want to make sure that your goals are being met more than anything. Preventative strategies, unbelievable amount of preventative strategies. We shouldn't be looking at your blood work to determine what medications are given. We should be looking at your blood work to determine what your nutrition should be so we can prevent medications, what type of supplements we can do to prevent you moving into a more intrusive or something that has more side effects or something that you're going to have to be on for the rest of your life. If we find out the causes of these things before they actually happen and look at your lab work a little bit more attentively, and not balancing you out with 95% of people, that a lot of people don't realize that lab work is based on 95%. Those reference ranges are based on 95% of the population. I don't know about you, but I don't want to be compared to 95% of Americans, considering 1 in 3 are morbidly obese in some parts of the country. Almost 50% are diabetic in some parts of the country. I don't really want to compare myself to that. I want to compare myself to those who are asymptomatic and healthy. And that's what we do here at the Wellness Institute of Dallas. Now, on top of that, with concierge care, if you're under this concierge care, the beautiful thing is we can give discounted health and wellness services, and give you health education and provide you supplementation at a significantly discounted price. Because if you're doing things that make you healthy, then, we want to reward you on those types of things. So annual benefits with our concierge health program, health and wellness program, there's 5 clinician visits, initial visit of 90 minutes and 60-minute follow-ups. 60 minutes. We're talking once a quarter, sitting down with your provider and having a true deep conversation about your health and wellness. In addition to that, you get 5 health coach visits and nutritional visits. These are people who are unbelievably educated and understand the world of nutrition and create not just help you say, eat this, don't eat that, but help you create a game plan for meals. I think that's one of the most important things. After doing this for over 8 years, the Wellness Institute of Dallas has realized that people want some menus, want some ideas. They don't want to get stuck in a rut with their nutrition. And that's one of the best things about our program is we help you create meal plans that work for you and your family. So it's a full family health and wellness plan. Access to advanced diagnostic testing. If people realize that, and especially at a discounted prices, if people realize that MRIs and CTs and blood work from a cash perspective are significantly less expensive typically than when it's ran through insurance. I use this all the time. I ask people how much an MRI costs, and usually people say $3,000, $3,500. I've had people tell me $6,000. And typically I can write a prescription or a requisition for someone to get an MRI within the next day or two for $450 out of pocket. If people realize that healthcare costs are really not that astronomical and they only add on a zero at the end when they go to your insurance, that's a problem. Now, here's the beautiful thing we're going to talk about is we can still use your insurance. If you have good insurance, let's absolutely use it. But advanced diagnostic testing, we're not handcuffed by medical standards. We're not handcuffed by what insurance will pay for, because we have negotiated discounted prices to find out what's truly the underlying causes of these things. So typically on patients, we do a significant amount more of testing to really get to the root cause and find what's happening in your physiology. Personalized healthcare and lifestyle plans. Like I said, having all this time with a health coach, nutritionist, with a provider to really get down to the bottom of your healthcare needs and help fulfill your goals is really what's the most valuable thing here. Now, unlimited messaging and support. Now think of that. If you have the ability to, oh gosh, what is going on here? I'm not sure. Well, if you can text us and have an answer within 24 hours, what an unbelievable resource that is, right? And typically, if it's during working hours, you can have an answer very, very quickly. Usually within an hour or two, we're going to be able to get back to you and say, this is our opinion. Here's some resources. Here's some things to look at on this side of the story. Here's some things to look at on this side of the story, and help you along with making decisions about your health. Prescription medications and supplements all in one location. Now, if you buy supplements, I was reading something that the average person spends over $100. People who take supplements spend over $100 in supplements a month. $100 a month times 12 is $1,200. What if we could give you a 15% discount off those supplements? And not only that, give you a 15% discount off of pharmaceutical grade, laboratory tested supplements that we know have exactly what's printed on the label. There was actually a research study showing that supplements, it's kind of the Wild West right now with supplements. There's not a whole lot of regulation. So if a bottle says it has B12 in it, there's no one double checking that, triple checking that, independently researching these supplements. Our supplements are all pharmaceutical grade, laboratory tested, third party tested to make sure that what they have actually has it. So not only are you getting better supplementation, but potentially at a cheaper cost. 10% discount off of infrared sauna sessions. If you haven't sat in an infrared sauna, it's unbelievable. It's amazingly detoxifying and is very relaxing. We oftentimes prescribe doing meditation and even stretching and doing certain things in the infrared sauna that can help further your health. 15% off regenerative medicine. We're talking stem cell therapy, PRP. We're talking even some of the aesthetic aspect of things, regenerative aesthetics like skin pen and PRP facials and those types of things that can help your, not just your inward health, but your outward health as well. So frequently asked questions, can I use my insurance? Absolutely. If you have great insurance, please, by all means, let's run your lab work through insurance, because that's what you're paying for. You're paying that health insurance company so that you can have some of these healthcare costs covered. I would say about 80% of the time we run labs through insurance, and most of which will be covered. Typically, there is a small percentage that the patient has to cover, and that's something that we'll go through when we look at when you sign up with our health concierge program to look at your insurance and determine what's going to be cheapest to do through cash and what will be cheapest to do through insurance. What happens if I have need an emergency visit? This is the beautiful thing about a concierge practice is you notify us and say, hey, I think something is going on, and we can have someone on the phone with you doing telemedicine. We oftentimes do telemedicine. We just did a telemedicine visit for someone who has an upper respiratory infection that's progressed overnight, and we already have them picking up their prescriptions and talking about nutrition and supplementation and things that can really help out. Infrared sauna being another one of those things too. So, but if I need an emergency visit, you call and let us know, and we get someone to you as fast as we can. What does this membership not include? So unfortunately, it doesn't cover testing, but like I said, usually your insurance can cover those testing. It does not include the cost of supplementation, and it does not include our chiropractic services. But the membership is fairly inclusive to just about everything in our office. It'll discount just about everything in our offices. Does my FSA, HSA dollars pay for fees, tests, and supplements? Here is the most beautiful thing about this. A lot of people with insurance plans will also have their business will also have an HSA or an FSA account set up. If you're already spending that money, great, but you can actually use this money towards your concierge program. If I told you that your concierge program, for the most part, could be covered by your FSA and your HSA dollars, essentially there's no cost to you for this type of program. It's an amazing thing. You can use those HSA and those FSA dollars instead of just going out and looking at your research and saying, well, I think I need this or I need that supplement. We can create a whole health program that is very well concisely provided for specifically you, looking at your lab work, looking at your testing, talking to you, most importantly, getting your insight about your own health, because no one knows your health better than you. And then we can create a game plan for essentially nothing if your HSA and FSA covers it. So our concierge wellness programs are very, very reasonably priced. A single person is $165 a month, unbelievably inexpensive when it comes down to everything that you're getting. We're talking 5 consultations with your primary provider, 5 consultations with your nutritional and health coach, and then all those discounts. So like I said, I did the calculations for myself. If I spend $2,000 a year, which is my actual cost on supplements that I buy, $2,000 a year for myself, and I get a 15% discount, we're talking $300 in savings. That essentially covers 2 months of my whole program just by the discounts that I'm getting on my supplements, not let alone if I have IV therapies or if I have, if I want to do a skin pen treatment or if I want to do regenerative therapy, massive, massive savings. And like I said, that $165 can oftentimes be 100% covered by your HSA and your FSA. Now, if you want to do a 2-person, we give a discount for 2 people. So this is for spouses. This is for, kids, over 18-year-old kids. This is for parents. A double membership is $275 a month, and the family plan. This is my favorite thing. We actually stole this from the type of insurance that I have, which is a MedShare. Family plan is $350 a month, meaning family plan, as in if you are 2 adults and 1 child, or 2 adults and 10 children, the family plan is the same price. It's an unbelievable, inexpensive monthly plan when you look at everything that you're getting. Now, with kids under 18 years old, they don't typically need as much concentrated focus, but we still need them to be educated. If our goal and our mission is to change healthcare trends across the United States, we got to start with kids and educating kids and teaching them what good, healthy habits are. So we include a single provider visit with them so we can establish care, and then we provide a single visit with the nutritionist and the health coach to determine what their goals are and help them understand what healthy is and what is not healthy. I think that's one of the big things, is understanding what is not healthy, because after this many years of doing this, I can tell you kids don't really realize what's healthy and what's not healthy. So education is crucial there. Now, if you text our office, 972-996-2420, the word concierge to 972-996-2420, we waive your initiation fee. This is a $500 fee that we typically charge to process your information, get you started in our program, and it's 100% waived when you text the office concierge to 972-996-2420. Now, here are some add-on packages that we found people are really interested in, and things that we do here at our office that are very specific. So we have an anti-aging package. It's 6 NAD IVs. I recommend going and researching these. 4 PRP skin pen treatments, which is for skin health. So it's not just the face, but we have a lot of moms who have had pregnancies who'd like to tighten up the skin on the stomach, or have burns or scars or things like that can be very drastically and FDA approved to show drastic improvement in those types of things, skin discoloration and those kinds of things. Infrared sauna package, daily access. We're talking for the whole year. You get daily access to the infrared sauna, and 20% off PRP and stem cell services. 20% off skin PRP injections, which are very beneficial for joints, for torn muscles, ligaments, tendons, those types of things, and stem cell services, which are intra-articular, in-joint issues, so knees, hips, and those types of things. Brain health focus. This is primarily my aspect of the office. There's a comprehensive neurological assessment, report of findings, a CNS vital screening, which is a highly sensitive test for cognitive decline, report of findings with that as well. Annual membership to an application for games that help your brain not only help with after a concussion or after head injury, but also help maintain our brain's function. And that comes with a clinician performance tracking, which means every time that you do your app, I get information saying that you did it and here's how you performed. Annual EEG. I mean, the cost of this program alone is covered on an EEG. 10% off anti-aging services. So that would be our skin pen, our PRP, and stem cell services. And then finally, our functional genetic analysis. A lot of people are super concerned about, well, my family has this, and my mom had this, my mom's dad had this, my mom's dad's mom had this, and I'm really worried about it myself. This is our comprehensive analysis and testing to see if there's a genetic proponent to this, or if it's mostly lifestyle. And here's the thing. A lot of times lifestyle is going to be the driving factor in these types of things. It'll turn your genes on to start pushing you towards what's called the phenotype of these types of disorders that are inherent in the family genes. And educational content. Okay, so now that you understand what our practice is and our concierge practice, I think you can understand our slogan a little bit better. So health you can feel, care you deserve. Health you can feel because we do things here at the Wellness Institute of Dallas that you can actually feel fairly quickly, right? We're not looking for instant gratification of medication, but we're looking for long-term health, things you can feel over the long term, and care you deserve. You deserve more than 5 minutes with a doctor. You deserve more than 3 minutes with a doctor if you're in a Medicare age group, right? So when it comes down to it, health you can feel, care you deserve is what we're looking to provide here at the Wellness Institute of Dallas. And like I said, initiation fee is waived if you text us concierge. That's a $500 savings, concierge, to 972-996-2420. Thank you very much, and we'll see you soon.